Hi, Megan. It's Kathleen, your CNA. The nurse asked me to come in and assist you with positioning on your side, okay?
Okay.
All right, I'm going to provide privacy. The first thing I'm going to do before we start, I'm going to go over there and let that side rail up because that's the side we're going to turn on, okay?
Okay.
You always want to make sure your side rails are positioned correctly prior to turning your patients for their safety. Now, because Megan is able to assist me in this skill, I'm going to have her help me with turning and positioning her. Now, at this time, Megan, what I would like for you to do is just turn on your side for me, okay? I want you to grab hold to that rail, and I'll do the rest with your pillows, okay? 1, 2, 3. Thank you. Now, some of your patients, in reality, you may have to assist them with turning, but in this skill, you're allowed to have the person help you. You want to also make sure anytime you're turning your patient on their side that you adjust their pillow. Don't just assume that this pillow is comfortable in the position that it was in previously. Megan, if you'll lift your head up, I'm going to slide it over a little bit. Is that better?
Yes.
Okay. Also, one of the things you want to make sure that you do is go over and check the arm that they turned on. You don't want them lying on that arm. So we're just going to pull this out just a little bit to adjust it. Don't forget to do that because remember, most patients that are turned on their sides are going to be on that side for a couple of hours maybe. So you don't want to cause any type of pressure ulcer. Now we're going to take a pillow and place one behind her back. And that's just for positioning to help her stay on her side. You want to keep your patient covered up. You never want to overexpose them. So we're going to take this pillow and what you do is put it behind the back and just kind of fold it under so that it props against them and they can just nicely relax on that pillow. Now, what we're going to do is we're going to place one between her knees and her ankles. You always want to put a pillow between here because you don't want bony prominence touching bony prominence. That can cause skin breakdown, and that's not good. So we're going to take a pillow and place it between her knees and her ankles. So you're going to lift up her little leg like that, place it down. You want this leg flexed or bent, okay? And then you want to make sure it's between the knees and the ankles. Again, we want to keep her covered up in the process. The other pillow, you're going to take and actually place it here for this top arm and let it rest on it so her arm is not just resting on her, causing any discomfort. You want to keep your patients covered up. And again, it's all about positioning the pillows and making sure that there's no bone to bone so that there's no skin breakdown. That's very important, especially for our bedridden patients. So once you've done that, now in that she's alert, I can let this rail down. If she was not alert and didn't understand, in order to have rails up, you need a restraint for that. But we are able to let this down for testing purposes because she's alert and oriented. You would also want to make sure that your patient has their call signal when you're done so that if she definitely needs us, she would be able to contact us. Okay, so I'm going to hand her her call bell or put it within her reach so that if she needs us, we're available. Megan, here's your call bell. Just give me a call if you need anything, okay? You want to make sure the bed is in its lowest position when you're done. And of course, at all times, when you're done with any skill, at the end, you want to say, I'd wash my hands. That's the end of this skill.